We will now try to help you manage an acute episode of shortness of breath and help you to slow your breathing down faster and give you a sense of being in control. When we do regular abdominal breathing, we are using the muscles in our lower chest and our abdomen. But when we do strenuous exercise, or if we are participating and completing an activity that requires a lot of exertion, other muscles in our chest are also used, the muscles in our upper chest and in our shoulders. Those muscles, however, are only available for short-term use, and when they get tired, they actually tense up. So, if we're getting out of breath, and these muscles are also tensing up, it becomes even more difficult to breathe. These muscles will need more oxygen, and our body is going to try and get that air in faster. So we will breathe faster, and we will also breathe shallower. We won't be able to get those nice deep breaths using abdominal breathing that we need because the muscles in our shoulders, in our neck, and our upper chest will be tensed up. That is a normal reaction. However, we want to try and help you gain control of your breathing back quicker, and we have a few simple steps that you can take to gain control of your breathing back. I strongly recommend you practice this series of steps when you're not short of breath, so that when you are, you'll be able to use them and they will come to you easily. So let's begin. You've, let's say, just gone up a flight of stairs too quickly, or just finished playing a game in the yard with some grandchildren or your children, and you're really out of breath. The first thing you need to do is you need to stop and get into a comfortable position. If you're standing, this may mean that you may need to lean against the wall. If there's a chair close by, have a seat. Once you're sitting or comfortable, immediately think about tilting your chin down towards your chest and looking at the ground. By placing your chin in that position, it's going to help to get your upper chest, shoulder, and neck muscles to relax. So, once you have your chin tilted down, keep it in that position for the rest of the breathing explanation. First, you will need to take 10 breaths in and out through your mouth in short bursts, like this. Towards the end of the 10 short bursts, you will begin to feel the muscles in your upper chest and neck relaxing. Immediately follow this with 3 breaths where you will breathe in through your nose and out through pursed lips, like this. After those 3 breaths, immediately follow with more breathing, but this time in through your nose and out through an open mouth. And continue to breathe this way until you feel your breathing almost completely slowed down and back to normal, like this. Okay, let's review that sequence again. Get into a comfortable position and tilt your chin down to your chest and keep looking down to the ground. While in this position, do 10 quick breaths in through your mouth and out through your mouth. During those 10 breaths, your upper chest and neck muscles will begin to relax. Follow those 10 breaths with 3 breaths where you breathe in through your nose and out through your mouth. Then follow with more breathing in through your nose but out through an open mouth until you feel your breathing slow down. I will demonstrate this once for you. Remember, it will still take a couple of minutes to slow your breathing down, but hopefully you will be able to recover your breathing back to a more regular rate and rhythm than if you weren't using this breathing pattern and sequence.